everyone. I'm Mandy Morris, and I have with me my colleague,
Rhonda McGinnis.
and we are founders and directors of Mosaic Counseling Group. And it was just really on our hearts to share some information and some mental health tips for our frontline medical workers who are so diligently having to be out doing their job in the midst of a pandemic. So Rhonda, I wanted you to maybe just kind of shed some light on what might be happening for some of them as they're having to deal with other people's trauma.
So it's called vicarious trauma, which is just secondary trauma. And it is essentially that when we bear witness to, or when you are trying to help someone who is suffering or traumatized or both, it's really what happens to those people who are helping. And that in the body, it shows up as a similar stress response to the patient. Those same chemicals of anxiety and even some feelings of helplessness, and some, people on the front lines, medical professionals are reporting pain, physical pain in their joints and all of those things as they hold all of that stress because their body is in fight or flight, that stress response all day long or all shift long.
Yeah. And so along those same lines, it's really important that they're processing their emotions. One of your greatest gifts as the frontline medical workers is that you're able to do your job and to suppress those emotions that you need to, so you can make practical decisions and be on cognitively. And that's one of the greatest gifts of how you've learned to be in this profession. However, when it comes to this pandemic that none of us have been through before, if you're suppressing your emotions and not dealing with the trauma of what's going on, then that's going to come out in other ways. It could come out in your shoulders, like Rhonda was saying. It shows up in pain sometimes, can show up in your gut. When we suppress our feelings, we tend to go into numbing mode, which could look like eating the whole jar of peanut butter or other sorts of overindulgences and substances that maybe serve as a way to keep things turned off. But in the long run, it doesn't really help. It actually makes things worse. And so it's important that you're acknowledging your feelings, putting a name to it. This is where emotional intelligence is really important, and understand where they're coming from, and then finding a trusted person who you can externalize it with. We want to be able to externalize our feelings and process through them.
Why is that such a big deal?
It's a big deal because if we're not processing, then we are vulnerable to possibly forming a negative belief about ourselves. And we know with trauma that one of the key features in post-traumatic symptoms, stress symptoms, is a negative belief existing, such as I'm responsible, I'm a failure, I'm not good enough, I'm powerless or helpless.
I should have done more.
Yeah, exactly.
I don't have the supplies I need to feel safe, even as I go home to my own family, that I'm not contaminated.
Yeah. What are some of the big negative beliefs that have come up with some of your clients that you know of?
Well, even with some relatives and friends for me, it's I don't feel like I have all the information, even though I'm a medical professional, and I can't even give it to my own circle of people.
Right.
Or some of them have said, like I said, I don't have the supplies I need to feel safe from myself being infected. And I feel like I should know more.
Right.
I should know more to be able to help inform my patients even. What about you?
Well, yeah, same types of things. And in being able to talk out those feelings and thoughts and process it with someone, you can then recognize, okay, is this something I would tell someone else, like, you are responsible, or yeah, you can't get your needs met. And so
you should know about this pandemic before it happens.
Right. Yeah. And so usually an easy way to get to our own logic is to think in terms of someone we care about. And if you would say it to them, because the reality is that you're doing the best you can do. You're enough as you are. You're doing the best you can. You actually are getting your needs met because you're surviving. And so being able to weed out those negative beliefs and connect with positive truths about yourself is going to really minimize any post-traumatic stress symptoms in the long run as well. So we wanted to also impart some kind of realistic self-care tips
Thank you for
because
saying that. Mandy, can I just say, I'm so irritated because it gets into my own beliefs too when I see all these great self-care tips that
yeah,
after we've worked for, even in the mental health side, for 9 or 10 hours, and they say, well, you should just take an hour bubble bath, or go work out, take an online yoga class for an hour and a half, and eat some kale or something. And all of them would be awesome, but I also have this life that I come home to.
right,
And
right.
so one of the things, as we were talking about this, is just, what can we give them that is even you could do on shift,
Hmm.
things you can do in the middle of it that will calm down your nervous system
Hmm.
and help, just so we know that you need high immune system function right now. And with chronic stress, it suppresses it. And so how can we help you to get some psychological as well as some physical relief in the middle of it?
So what's the first tip you give them?
um, so I think my first one, honestly, it would be permission slips. I love Brene Brown. So
Yeah.
many people know about her. And she is a big proponent, and so am I, of writing permission slips to yourself. A big stressor can be if you're a medical professional, especially in your family. Everybody's coming to you, checking in. How's it going? And what do I need to know about this? And did you read this article? So if you want to write yourself a permission slip that you do not have to return all non-essential messages
Hmm.
from your circle after a shift or a long day or evening. If you could just write yourself that permission slip, it's going to help you out, because it's not just one more thing and you have to relive it again and again and again and
Yeah.
again by really well-intentioned people that love you. That would be number one for me.
Awesome. Yeah.
What
I
about
think
you?
another really practical one, just in both of our EMDR background, is the value of doing tapping, bilateral tapping, just because with any trauma going on, your nervous system is jacked up and you got to do some things to get those cortisol levels down. So the one that I show all my clients that's really helpful is the butterfly hug. You're crossing your hands over your midline and you're just alternating tapping back and forth, just kind of in a rhythmic way. And you don't have to do it just like this. You can do it on the sides of your legs, you can do it on the side of your arms, something like that. Yeah. And any sort of rhythmic alternating movement. But that what that does is it gets you out of the anxiety part of your brain, because uh, when you do the bilateral stimulus, it alternates different signals to your mind, and that essentially helps calm your nervous system down, and it detaches you from whatever the stressor was, because now your attention's on the bilateral movement. So butterfly hug would be my first anti-anxiety technique. Do you have another one for them?
Yeah, when we're talking bilateral stimulation, take a walk.
Mm.
If you're on a break, or if you just need to take the long way round when you're doing rounds, if you're at a hospital situation, walk, because that's stimulating the left and right side of your body, which forces us to stop being stuck in our survival brain, in the limbic system, forces us up into the other parts of our brain. And
Don't be on your
therefore,
phone while you're walking, right?
well, if you're going to be on your phone, watch the Parks and Rec reunion
Yeah.
or something funny.
Yeah.
Oh, that's the other piece of it, is limit scrolling. There's a lot of research on this in the last couple of years, limiting the amount of news you take in, especially right now, because you're taking it in anecdotally first person when you're at your job. And then to be scrolling on it, it's actually a form of numbing out that actually causes us stress. So I would caution against it. If you need to check the news, I absolutely am a proponent of it. Do it a couple times a day.
Yep. Yep. I think the last tip I would give, it's kind of my crisis slash stress 101, and that's eat, sleep, talk, trust, and feel. So eat, sleep is pretty self-explanatory. Talk out what's going on, feel your feelings, and trust the people who support you, and trust your process as well. And if those are the only 5 things you do in a day, it's a win.
Yeah, I feel like I could get things done with that.
Yeah. Yeah. Any other tips for them?
I don't think so. It's important at the end of the day, however you get home,
Mm.
um, that you're aware of what's going in when you do that. So whether you've got a playlist that gets your mind off things, or kind of a ritual, or that was the best I had.
Mm-hmm.
Today I gave the best I had.
Yeah.
And now I got to go do the rest of my life. And
Yeah.
I've got to, what is it? Eat, sleep, talk, trust, feel.
Yep. Yeah.
Love it.
Well, we really appreciate and have a lot of respect for you frontline medical workers. You're doing really good work out there. We understand that fatigue is setting in. We're over a month into this now, in the extreme parts of it, even though you've been dealing with this way before the shelter in place actually happened. So just wanted to validate that we know that this has been hard. You're doing good work, and continue to take care of yourself just as much as you take care of other people. And so we hope this information is helpful for you.